For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. PWU School of Nursing has been offering high-quality, student-centered, and innovative nursing programs for over 6 decades. PWU's graduate programs upgrade the qualifications of nursing professionals, allowing them to advance in their chosen fields in the Philippines and globally. In the allied health fields, PWU pioneered in programs such as pharmacy, which was established in 1926 to train students who want to succeed in any aspect of pharmacy services. The first women doctors polyclinic in the Philippines was set up in PWU in 1951. In 1986, PWU's Bachelor of Science in Nutrition and Dietetics became the first nutrition program to be accredited by the Philippine Association of Colleges and Universities. PWU was also the first educational institution in the Philippines to focus on the prevention of acute illnesses and chronic diseases through its Master of Science in Clinical Nutrition program taught jointly with the St. Luke's Medical Center. PWU School of Medical Technology offers a competency-based curriculum enhanced by intensive training in clinical laboratory procedures. Offering a Bachelor of Science in Medical Technology and a Master's program in Medical Technology and Health Systems Management, PWU also offers a certificate program in phlebotomy. In nursing and the allied health fields, PWU continues to play an essential role in healthcare education, producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
Webinar Rules and Regulation. Find a place conducive for learning. Put your mic on off or mute to avoid unnecessary noise and unusual sounds. Lend an ear if someone is speaking. Let him/her finish the statement before stating your point of view. For the question and answer portion, prepare your question for the resource speaker and wait for the cue of the host on when to submit it via live streaming chat box. And lastly, observe online etiquette at all times. Good morning, everyone. Thank you for finding time on today's webinar entitled Maternal Nursing Care During Pandemic, Nurse Enabling and Empowering. My name is Neri Cahayan Navicilia, a Doctor of Philosophy in Nursing student and the Chief Nurse of Maria Estrella General Hospital in Oriental Mindoro, and I will be the moderator for today's event. Before we proceed, I would like to inform all the participants that we are live on Facebook and YouTube. You may click share so that others may know this activity. Ladies and gentlemen, let us begin with a short prayer and give respect to the Philippine flag through the pambansang awit ng Pilipinas.
Let us put ourselves in the holy presence of God. Father in heaven, always merciful and giver of life, we humbly ask that you bless each one of us, from the speakers, program committees, guests, and participants. Guide us to make better decisions as we incorporate what we will learn throughout this activity. Thank you for the infinite blessings and countless opportunities. Lord, today as we start our activity, may we always be grateful to learn new things. Shed the light of your wisdom and bless each one, especially our speakers, as they will share their knowledge to us. Through your mercy and grace, may peace and utmost understanding shine and dwell unto us. Almighty God, accompany each one and help us concentrate for us to gain more knowledge as we listen attentively. This we ask in your name. Amen.
We are so happy with your presence and participation in this event. And we know by the end of this webinar, you will gain valuable insights that you may apply in your daily lives. In the meantime, let me call on my co-webinar facilitator to acknowledge your presence in this very important event. She is the nurse 4 at Rizal Medical Center in Pasig City, no other than Ms. Arlita Banaag Villamiel.
Good morning, everyone. On behalf of the organizing committee, we would like to acknowledge our distinguished participants in today's webinar. We have here our dearest students and faculty members from the different academe, schools, foundation, universities, and colleges, both locally and abroad. Students who are presently enrolled in the following courses: Bachelor of Science in Nursing, Master of Arts in Nursing, Doctor of Philosophy in Nursing, Bachelor of Science in Midwifery, Caregivers, BS Biology students, Nutrition and Dietetics, and BS Pharmacy. Also the participants from different hospitals, both private and government-owned, the medical centers, provincial hospitals, regional hospitals, rural health units, OB/GYN clinics, lying-in clinics, birthing homes, maternity clinics, and diagnostic centers. Let us also welcome and acknowledge our participants from private companies, government, and non-government organizations. Participants from the Department of Health, Department of Education, the Association of Nursing Service Administrators of the Philippines, Philippine Nurses Association, Mother and Child Nurses Association of the Philippines, Operating Room Nurses Association of the Philippines, Integrated Midwives Association of the Philippines, city health offices, and local government units. To all the participants, thank you very much for gracing us your time to attend this very important event of us, Doctor of Philosophy students of the Philippine Women's University. We are all overwhelmed for your presence and looking forward for all the learnings that you will acquire as you listen to our dear speaker. Again, thank you very much and a warm welcome to all.
Thank you, ma'am. And now, to formally welcome you all and explain the objective of this activity, may I call on the leader and the overall chairperson of this program. He is a Nurse 1 at Hospital ng Binyan City, Laguna, Mr. Sam A. Marceliana.
To our University President, Mr. Marco Alfredo M. Benitez, to our University Chancellor, Dr. Felina C. Yang, to our Dean, Dr. Minerva A. De Ala, to our keynote speaker, Dr. John Oliver Z. De Leon, the Faculty of School of Nursing, friends, guests, students, educators, healthcare workers, and non-healthcare workers. A pleasant day to all of you. I am honored to welcome you to this webinar as another opportunity to share with what we have and learn from each other. We have heard a lot about the pandemic, its cause, statistics, the numbers, the stories of life, victories, and devastatingly, the countless losses of loved ones. But we continue today in battling the unseen foe. As healthcare providers, we have proven to be in the front lines of various health crises. More so, as we face the challenges of this pandemic, we continue to provide the best nursing care to our patients from all walks of life. In this webinar, we will highlight the role of nurses in caring the pregnant women. As we all know, caring for a pregnant patient carries a greater responsibility, bearing in mind that the health of the fetus will always be dependent on the mother's well-being. For the non-healthcare workers or providers, general knowledge about maternal health, updates on the most recent and basic maternal concepts, and how to protect their families by applying the concepts, and how people can relate to the topic based on personal experiences are the learnings we could learn from this webinar. As we proceed, may we all maximize this opportunity to learn, and may we become instruments of God as we continue to care for the expectant mother and the fetus. Once again, I welcome you all to this webinar. Enjoy learning.
Thank you, Sir Sam, for your warm welcome to all of us. Ladies and gentlemen, one of the most important part of this program is listening to the inspiring words of one of the brilliant people of Philippine Women's University. She is the Research Director, Learning Management System Administrator, and Department Chair of Information Technology. I am proud to present to you Dr. Menchita Falcutila Dumlao.
To our President, Mr. Marco Benitez, SBPAA and Chancellor, Dr. Felina C. Yang, Dean Minerva de Ala, to our guest speaker, faculty members, and students, it is a great experience to witness today's event as the organizers of this webinar brings relevant topics and discussions. Good morning to one and all. Congratulations to the organizers of this webinar and to the School of Nursing for this success and their continued support in producing potential and diversified talents in this extraordinary drive, ambition, and above all, commitment to excellence. Time flies, and it has been 7 months since all of us were locked down. We are facing a lot of uncertainty, like a surge of emotions hitting us, and yet we are all here, gathered to continuously bring knowledge to our students and the community, because we believe that learning should continue and that the spirit of resilience among women shall prevail. This webinar is timely and relevant because as it focuses on empowering our nurses with maternal care during pandemic. There is a very little research about missed nursing care in the neonatal and pediatric inpatient settings. Missed neonatal and pediatric nursing and nursing care was associated with workload, patient equity, work environment, nurse characteristics, and prolonged hospitalization of preterm infants. Missed nursing care and related patient and nurse outcomes in diverse pediatric samples remains an area of future research. The vast majority of women deliver in a health facility, and yet maternal and neonatal mortality remain high. Ensuring competency of health workers in providing essential maternal and newborn intervention in health facilities will be the key if further progress is to be made in reducing maternal and neonatal mortality in low-resource settings. Those were the challenges, and there are many other challenges that this webinar wants to tackle with the help of our expert speaker. There are some kinds of challenges such as integration and expansion of midwifery and family-centered model of care, reduction in the use of unnecessary or questionable benefit technology, patient and family teaching, the questionable need for a normal newborn nursery, or the future endeavors that we are inspired to pursue with students and faculty members. Again, I congratulate the organizers and the School of Nursing for this well-organized and very relevant webinars. I hope that all of the participants will benefit with the knowledge and skills that this webinar will bring out to you. Thank you, everyone, and good morning.
Thank you, Dr. Dumlao, for your inspiring message. At this point of time, to introduce to us our resource speaker, may I call on another facilitator of this webinar. She is the Chief Nurse of Medical Mission Group of Hospital of Oriental Mindoro, Ms. Sandela Zamora de Guzman.
Good morning, everyone. Our speaker is the Director for Academics and Services and the Dean of Review of the biggest review center in the Philippines, Asian, Middle East, and the Asia Pacific, Dr. Carl Balita Review Center. He leads the center's core processes, curriculum development, classroom, and in online review delivery. He assures the company's vision and mission, producing more than 100,000 professionals and long list of that nature. With his team leadership, CBRC continuously grows in enrollment and expansion, filling Philippine Arena in 2018 and 2019, having more than 120 local and international branches. Awarded as Super Brand 2018, PFA Hall of Famer 2019, and the first ISO Certified Review Center in 2019, where he is a member of the Quality Circle and Auditors, proving CBRC excellence. He is also a pioneer franchise of CBRC. He holds the license to operate one of the biggest and multi-awarded CBRC franchise network, CBRC Pampanga, Antique, and Aklan. He is dubbed as the Dean of Review, the highest rated reviewer. He has facilitated more than 1,000 speaking engagements locally across all regions of the Philippines and internationally in Dubai, Abu Dhabi, Ajman, Indonesia, Hong Kong, and Thailand, among others. He shares his blessing and collaborates with different organizations for his social enterprise and corporate social responsibilities. In 2020, he is also elected as the Chief Educator Officer of the HEALTH, a national alliance of health practitioners for healthcare advocacy, a member of the Alliance of All Health Organizations of the Nation with PNA, PMA, PHA, PAMIT, PLG-PMI, among other health organizations. An executive graduate School Faculty of Pan-Pacific University for Masters in Business Administration, Master of Arts in Education, and Master in Public Administration. He is also a guest faculty of various nursing schools and the national moderator of the National Assembly of the Philippines, Philippine League of Government and Private Midwives Incorporated, which he is being held this month, In 2020, he uses TikTok to share knowledge as an official content creator for health and wellness. His videos will reach almost 5 million views, more than 70,000 followers, and almost 400,000 likes. His Facebook page, his platform for positivity, advocacy, and motivation, has more than 80 followers and more than 2 million reach. At a young age, he is a registered nurse, registered midwife, licensed professional teacher, criminology graduate, pursues AB International Studies, a board top-notcher, cum laude, dual master degree holder, Master of Arts in Nursing, and Master in Business Administration. He finished his executive doctorate in educational leadership and pursuing his second doctorate, PhD in nursing. He was a finalist of 2012 10 Young Employees of Metro Manila, an ambassador for peace by the World Confederation for World Peace, and ambassador for indigenous people. He is CBRC's Hall of Famer faculty, top notcher of the decade, review icon, digital marketing expert, Inspiration 2000, a proud Philippine, and recently hailed as Asia CEO Award 2020, Young Leader of the Year Circle of Excellence by the highest business award giving body in the Asia Pacific, the Oscar of Philippine Business. Ladies and gentlemen, Dr. John Oliver Janus de Leon.
And thank you so much for that very wonderful introduction. But before I start my discussion, I would like to start with two things. The first one is I would like you to give a smile on your faces. Try to smile. Okay, wherever you are, where maybe you're in Facebook or in Google Meet right now, try to give a smile. Why? You are blessed. Blessed to open your eyes today, and blessed to share whatever you have today to your families and to your friends. The second one that I wanted to share to you is I want you to continue believing and dreaming. That is actually a very lengthy introduction of mine, but I want you to understand that I just started dreaming that it can happen, and that's how we make dreams and dreamers one. So today, let me start my talk to all of you regarding maternal and health nursing. So basically, maternal nursing care in the pandemic is actually very timely for all of us because in every household there are mothers, there are children, and this is going to help them to adapt and be enabled and empowered. These are my agenda. Number one is maternal health and nursing. The next one is COVID-19 and the new normal. The third one are the updates on maternal protocols. And the last one is enabling and empowerment. And I hope you stay with me until the end because I want you to be a better person. Some of you are not nurses. Some of you came from the general community people. And by watching here, I want you to learn not only maternal nursing, but I want every person listening to me right now to be enabled and empowered to be a better version of themselves. The expectations for today are the following. If we're going to break it down, we're going to talk about maternal health in general, the maternal health nursing, maternal health status in the Philippines and in the world, the effects of COVID-19 and the new normal, which is being felt wherever we are right now, the maternal health programs, maternal health protocol changes in the clinical setting and the community setting, and the last is enabling and empowering nurses and the community, which includes every one of us. Let's start with the maternal health. Maternal health is defined as the health of women during pregnancy, childbirth, and the postnatal period. Always remember that when you talk about the health of women or maternal health, it deals with the pregnancy, childbirth, and the postnatal period. But when we talk about maternal health nursing, it deals with the nursing specialty that deals with these areas: pregnancy, childbirth, and postnatal period. And what do nurses give? Actually, nurses give care. The care that we give is really our specialty. The care that we give to the people and the community as well. And of course, the NCP, the nursing care plans being applied during pregnancy, childbirth, and postnatal period. Each stage should be a positive experience, ensuring women and their babies reach their full potential for health and well-being. Most maternal deaths are preventable with timely management by skilled health professionals like nurses in a supportive environment. Ending these preventable maternal deaths must remain at the top of the global agenda and of course the government's agenda as well. At the same time, simply surviving pregnancy and childbirth can never be the marker of successful maternal health care. It is critical to expand efforts in reducing maternal injury and disabilities to promote health and well-being. Every pregnancy and birth is unique. Addressing inequalities that affect health outcomes, especially sexual and reproductive health and rights and gender, is fundamental to ensure all women have access to respectful and high-quality maternity care. Let's talk about some statistics. Let's talk about the births in the Philippines. How many are being born in the Philippines? In the latest data in 2018, as of December 27, 2019, by the National Statistician and Civil Registrar General, CMO 2019-230, there are 1.6 million, 1,668,120 births in 2018. That was 4,570 births per day, 190 babies birth per hour, and 3 babies per minute. So meaning, at this very point that I'm talking right now, 3 babies are being born. And the next minute, another 3 babies are being born. We can see that increasing population, or the population of the Philippines, is actually our treasure. They may say that it's actually for poverty, a cause for poverty, or other negative instances. But I think having this birth is actually an opportunity for all of us. Opportunity for health workers, and opportunity for our workforce as well. That is actually a crude birth rate of 16 per 1,000, meaning to say in every year, in every 1,000 Filipinos, 16 babies are being born. Let's look at this data. The number of registered live births show the decreasing trend. Actually, the live births in the Philippines is decreasing, okay? Noticeably, from 2012 to 2018, the decrease in the last 6 years was 6.8%. That was actually from 1.7 million to 1.6 million. That's 1.8 to 1.7 million recorded births in 2018. Okay? And then sex ratio of births. Okay, let's make this webinar or talk very, very interactive. I would like to share your thoughts with me. I'm reading your comments on Facebook, so please kindly chat or kindly participate with me. So if I'm going to ask you, when you talk about sex ratio, it is a ratio of the males to the females, okay? Who do you think are being born more? Is it the males or the females? Well, generally, the population of the Philippines has more males than females. And in 2018, yes, we have more. We have, in every 10 females, 11 males are being born. So to the girls out there, okay, don't worry. There's a lot of males out there, okay? But I think that we have a problem with that because other males are also looking for other males Just joking, okay? So this is our sex ratio, okay, in the Philippines. Some reasons why this is our sex ratio is because they said that the male sperm or the Y sperm is actually faster than the X sperm, okay? The occurrence of births per region. So the most number of births in the Philippines is actually from the NCR or the National Capital Region. So again, I'm going to ask you another question and I hope you participate in the comment section. After the National Capital Region, what region has the biggest or has the highest occurrence of birth? What do you think? Region what? To our organizers, you can also answer. Okay, what do you think is the next biggest aside from the National Capital Region? Okay, the next biggest occurrence of birth is actually Region 4A or Calabarzon. Okay, Region 4A or Calabarzon. In the NCR, that is actually around 18.5%, and in Calabarzon, that is 13.8%. Okay, let's talk about distribution of births by months. Okay, this is actually important for us health workers, so we can actually prepare, especially those hospital administrators, what months have more births than the other months. Okay, so what do you think? Again, I'm going to ask you to pose you another question. What month has the biggest number of births? Can you please answer? Excuse me. Okay, the biggest number of births by month is actually September and October. September has 156,820 live births, while October has 155,713 live births. What is the implication? So for the health workers, you have to prepare more to give more live births on September and October. So maybe you're wondering, why do they have more births during September and October? Why? Because babies born in September and October are actually born or made in December and January. So you know what that means. Those are the months of vacation, of loving, and like that, okay? Now, births by attendance. Excuse me. Okay, in the Philippines, physician has the highest percent distribution of live birth attendance. So that's 66.3%, followed by the midwife of 26.6%. And then the nurses of the traditional hilot or birth attendance at 5.5%, and the nurses at 1.4%, and the others at 0.2%. So what is the implication? Okay, the implication is the higher the births are being attended by health professionals, the better for the people. Okay. So let's talk about the maternal mortality in general. So we have talked about the births. Now let's talk about the maternal mortality. Okay, the maternal mortality. This are called the maternal deaths, which is the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and site of the pregnancy, from any cause related to or aggravated by pregnancy or its management, but not from accidental or incidental causes. So let's look at it, the data. In 2017, this is a general data of the world, 810 women die per day because of maternal causes. And between 2000 and 2017, the maternal mortality dropped 38% worldwide, and that's actually a good news. And 94% of our maternal deaths occur in low and lower middle income countries. So countries with higher poverty rates has higher maternal mortality rates. And it occurred more on young adolescents, 10 to 14. Remember, the best age to get pregnant. What do you think is the best age to get pregnant? The best age to get pregnant is 20 to 35 years old. In other books, it's just 20 to 30 years old. In other books, 20 to 35 years old. Remember, if you're 18 to 20, that is actually at-risk pregnancy. And less than 18 is high-risk pregnancy. And we can see in the data that young adolescents aged 10 to 14 has high risk of dying because of pregnancy. In the Philippines, the lowest age for consensual sex is 12 years old. And if you know, you've heard of the news that they are actually increasing the age at 16 years old in the Philippines, okay? Now, let's look at the data. This data shows the maternal mortality rate in the Philippines, okay? In 2007, there are 149 deaths per 1,000. That's actually very, very high. In the latest data of the MMR, according to the Philippine Statistics Office, there are 121 maternal mortality deaths or maternal deaths per 1,000. Is it high? Do you think it's high? What do you think? Is it really high? Yes, the answer is actually high because the accepted by the SDG, Sustainable Development Goals, is 70 per 100,000 live births. That's 70 per 100,000 live births. And in the Philippines, we have 121 per live births, which actually is improving from 2007 from 149 to 121. And according to the Philippine Development Plan created by the Duterte administration, they're actually wanted to achieve, okay, they're targeting, they aim to have the maternal mortality ratio to 90 by 2020. And I hope the Philippines achieve that goal. Now, let's talk about the major causes of maternal death. So maternal mortality ratio is the number of women who die during pregnancy and childbirth per 100,000 live births. So what are the causes? The first one is severe bleeding. Severe bleeding, which is mostly bleeding after childbirth, okay? Remember that women die as a result of complications during and following pregnancy and childbirth. And most of these complications develop during pregnancy, and most are preventable or treatable, as I've mentioned. The first one is severe bleeding, which is mostly bleeding after childbirth. The next one is infection, which is, again, usually occurs after childbirth. The third one is high blood pressure during pregnancy. And our term for high blood pressure is preeclampsia and eclampsia. And the fourth one is complications from delivery, from the actual childbirth, from the actual delivery. And the last one is unsafe abortion. Excuse me. And remember, women's lives can be saved. That's why we are here. That's why you are listening from me right now. To all the healthcare workers are out there, we can prevent maternal deaths. We can save lives. And to all those listening from the general community or the non-health practitioner, you're here to listen more so you can save your own lives or save the lives of your loved ones. How can we do that? Remember, go for hospitalization. Now we have COVID-19. What is better? Is it home delivery or hospital delivery? Remember, hospital delivery is still safer than home delivery. For severe bleeding, what can we do? Severe bleeding can kill a healthy woman within hours if she is unattended. So injecting oxytocin in the hospitals or in the healthcare facilities immediately after birth effectively reduces the risk of bleeding. And for infection, after childbirth, it can be eliminated if good hygiene is practiced and if early signs of infections are recognized and treated in a timely manner. And for the high blood pressure or preeclampsia, it should be detected and appropriately managed before the onset of convulsions, or what we call eclampsia, and other life-threatening complications. Administering drugs such as magnesium sulfate for preeclampsia can lower a woman's risk of developing eclampsia, and that's how we can save lives. There are many reasons. As I've mentioned, one of the greatest factors to save a life of a woman is to bring them to a healthcare worker or be attended by a health professional. So there are just some main factors that prevent women from receiving or seeking care. Number one is poverty. You don't have money to do it. The next one is distance to facilities. Accessibility is still a problem. The third one is lack of information. And that is why you're here, to be informed, to know more. The fourth one is inadequate and poor quality services. So still, health services may be available, but it's inadequate, or the quality is actually poor. And the last one is cultural beliefs and practices. Yes, in indigenous, I am an ambassador for indigenous people, and in the indigenous community, they're still not practicing birth attendance by health professionals. As I remember, my thesis and my Master of Arts in Nursing at the Philippine Women's University is about pregnancy, childbirth, and child rearing among Aita mothers. And I can still remember that some practices by the Aita mothers is number one, is they don't give breast milk immediately to the child. Okay? So the colostrum is not given to children, to Aita children, but they give ampalaya extract instead. Another thing about cultural beliefs is they give birth alone. And see how risky it is for the mother. So how can we improve maternal health? So according to the Ending Preventable Maternal Mortality Strategy with the World Health Organization, these are things which we can improve maternal health. Number one, addressing inequalities in access to and quality of reproductive, maternal, and newborn healthcare services. Accessibility, giving free services to the people. Ensuring universal health coverage for comprehensive reproductive, maternal, and newborn health care. Maybe you're asking right now, how can we access, how can we have universal or pangkalahatang kalusugan for us, for the non-healthcare practitioners? You can actually visit your health centers, and they're giving these programs affordable, or some are giving it for free. Addressing all causes of maternal mortality, reproductive and maternal morbidities and related disabilities, preventing this, or seeing early treatment or prompt detection. Strengthening health systems to collect high-quality data in order to respond to the needs and priorities of women and girls. Ensuring accountability in order to improve quality of care and equity. So we're going to give healthcare to all, specifically maternal healthcare. So let's talk about the 4 pillars of safe motherhood. So we want to prevent problems. So let's talk about the 4 pillars of safe motherhood. So I have a mnemonics for the 4 pillars of safe motherhood. My mnemonics is actually FACE. Can you please say it? FACE, okay? FACE. So let's start with the letter F. Letter F stands for your family planning, okay? The most important pillar of safe motherhood is actually family planning. You want to plan for your family. Now, I have a question. In family planning, do you want to have a baby or you don't want to have a baby? I want you to answer it in the comment section. Again, I'll ask the question. Do you want to have a baby or you don't want to have a baby? In family planning, the answer is yes. You want to have a baby, but at the right time, the right age. Okay, that's called family. That's why it's called family. You want to create a family and you want to plan your family for the better. Another question. Should daddy be wearing a brief? Yeah, you heard me right. Dapat ba naka-brief si daddy? Well, the answer is yes. For me, the answer is yes. Why? Because my mnemonics for the 4 pillars of family planning is actually BRIP. B-R-I-P. Let's start. Okay, the first one, letter B, is birth spacing. When we talk about birth spacing, okay, let's talk about some best age to get pregnant first, or best time to get pregnant, okay? Number 1, I asked this question earlier, or I told you the answer already. Maybe you remembered. You can post it in the comment section. What is the best age to get pregnant? I hope you understand. I hope you remember. What is the best age to get pregnant? Well, the best age to get pregnant is 20 to 35 years old, or 20 to 30 years old. Now, let's talk about the spacing, okay? What is the best spacing? Or the years in between pregnancies? See? You can comment in the comment section. I'm watching. The best space, other books would say 2 to 3 years, and other books would say 3 to 5 years. So let's put it on average, 3 years, okay? The best birth spacing for you, mothers, and your children, okay, economically, okay, is 3 years, okay? Now, next question. What is the best number of children? Okay, you can comment in the comment section. Thank you for all the viewers. We're having so much viewers right now. And I thank you for that. What is the best number of children? So mga nanay dyan, sa mga magulang, ilan kaya ang pinakamagandang number of children sa ating mga anak? Well, the answer is 3 and below, okay? 3 and below. That's good for you and for your family financially and economically as well, okay? Next question. What is the best time to get pregnant? Think. What do you think is the best time to get pregnant? Well, the best time to get pregnant is when you want to have a baby. Remember that. The best time to get pregnant is when you want to have a baby. Remember that. Now, the next letter is R. And letter R is respect for life. Respect for life. We will always say no to abortion. In the Philippines, abortion is not accepted, or intentional abortion is not accepted. And as healthcare workers, the nurses, I know some midwives are watching me right now, okay? And some doctors are watching me right now. Remember, respect for life. The third one is letter I. What do you think is letter I? It's informed. Informed what? No, not informed consent. It is not informed consent. If it's informed consent, you have to sign a consent before doing it. And you need a witness while doing it, okay? It's not informed consent. What is it? It's called informed choice. Informed choice. Again, why are you here? For you to be informed of your choices for family planning methods. So basically, let's talk about some family planning methods for all of you guys. There are 3 family planning methods, okay? The number 1 is natural, the second one is artificial, and the third one is permanent methods. So let's talk about them. When you talk about natural family planning method, it's just a woman is looking at her body or listening to her body. You have to listen to your body. It knows when you're fertile. When I say you're fertile, you're ready to get pregnant. You have egg cells ready to get pregnant. And when I tell you that you are safe, it means that you will not be pregnant, okay? So let's start with the natural family planning methods. The first method for family planning, or for natural family planning method, is called the calendar method. Okay? For those who are taking notes right now, you can take down your notes as you want. The first one, what did I say? The first one is calendar method. When you talk about the calendar method, you have to watch your cycle, your menstruation. Okay, one cycle is from the start of the first drop of your menstruation, okay, to the drop of the next cycle of the menstruation. Okay, so you're going to count those days. Okay, so basically day 1 is always the first drop of your menstruation. Okay, always remember that. So let's start. Okay, you have to count your cycle for 6 months. Okay, that's 6 months, and you have to get the longest cycle and the shortest cycle. Okay, so that's 6 months. You have to count monthly, and then the longest cycle and the shortest cycle. What do you do? Longest cycle minus 11 and shortest cycle minus 18. You just have to, that's standard numbers, okay? Longest cycle, for example, your longest cycle example is 32 days. That's minus 11. And shortest cycle example is 27. That's minus 18. And the number that you will get are the days in which you are actually safe to do it, okay? You are safe to do it if you don't want to get pregnant. But if you're aiming to get pregnant, those are the days in which you have to do it, okay? That's called the calendar methods. The next one is called the BBT. The BBT, also known as the basal body temperature. The basal body temperature. When you talk about the basal body temperature, okay, you're looking at your temperature, so you need a thermometer. You do it in the morning. Upon waking up, before arising, you get your thermometer and you insert it in your axillary or your underarm, okay? And then what do you do next? Okay, you wait for it, okay? So you do it every day. You record your temperature every day. And after you recorded it, okay, after some time, you were going to notice something. What is that? There is an increase of your temperature at some points, okay? And that is an increase of 0.2 to 0.6 degrees Celsius. And if you notice those increase in your temperature, you are safe. And according to research, this is the basal body temperature is one of the most effective method for natural family planning. Okay, next, the third one is called the cervical mucus method. The cervical mucus method is also known as the Billings method. The Billings, also known as the Spin-Barkay method. So if you've heard me right, I hope some children are not listening to me right now. When you talk about cervical mucus, you are going to get your cervical mucus early in the morning. Upon waking up, before arising, you're going to get it, okay? And you're going to check it, okay? You have to observe it. You have to look at it, okay? Look at it and then stretch it. What do you do? Okay, if your cervical mucus is thin, okay? Thin, watery, it's like water, para siyang tubig. Watery and stretchable, okay? You stretch it, okay? And if it's 1 to 2 inches stretchable, you are fertile, okay? So what happens if you're not fertile? Well, you do it again, okay? You get it, okay? And then, what do? You check it. And if you check it, it's actually thick mucoidal, para siyang sipon. Thick mucoidal and non-stretchable, okay? Meaning, you're safe, okay? So, if you want to get pregnant, you let the barangay captain enter the barangay hall, okay? So, if you don't want to get pregnant, you close the barangay hall, okay? So, that's your natural family planning methods, okay? I've mentioned to you the Spring-Berkey, the Billings method, okay? Now, let's talk about your symptothermal. The fourth one is symptothermal. When you talk about symptothermal method is actually the combination of your basal body temperature and your Billings or cervical test. You just do both, okay? You just do both, okay? The fifth one is what we call the 2 days method. When you talk about the 2 days method, I would like to ask the girls right now, who are listening right now, I would like to ask you a question, okay? When you wake up in the morning, sometimes you feel that you're wet. In Filipino, pagising niyo ng umaga, minsan, di ba, pakiramdam niyo, para kang basa. Alam niyo na kung saan yun, ha? Okay, para kang basa, right? Yes. Actually, according to research, if you feel wet, okay, are you wet? Basa ka ba like that in the morning? Okay? So, if you feel wet, basically, for 2 days, that's why it's called 2 days method, you're actually fertile, according to research, okay? But if you felt dry or not wet, okay, and you are safe, okay, you're safe to do it, okay? And the last one is what we call the standard days method. It's the easiest one. You don't have to compute and don't have to check, okay? The standard days method, okay, the standard days method, okay, uses a standard number, okay, for you to know if you are fertile or not. It's called the standard days method. Okay, and others, they're using the beads method. Maybe you're familiar with the beads. You know the beads? Okay, it looks like a bracelet with colors brown, or dark black. You have the brown and the white and the red. They're white and there's one red there, okay? So what is it? It's not the bracelet of the children, okay? Pera usol, okay? So let's talk about your standard days method. This is only applicable to women who have menstruation for around 26 to 32 day cycle. Again, 26 to 32 day cycle, okay? So it's only applicable for you, okay? So what is the standard days, okay? Day 9 to day 18. You don't have to compute anymore. If you have a menstruation of 26, more than 26, but less than 32 days of menstruation cycle, then you have a standard days of 9 to 18, day 9 to day 18. How do you do that, okay? You count, okay? You count. The day 1 is your first day of menstruation. Ang unang patak ng regla is day 1. And you count 1, 2, 3, 4, 5, 6, 7, 8, 9. And on the 9th day, you are fertile or don't have sex. Those are your fertile days. Don't have sex if you want to have a baby, and have sex if you want to have a baby, okay? And those are your natural family planning methods. It's listening to your body, walang gastos, okay? So the next one is what? The next one is artificial family planning methods. So basically, we have 2 types of artificial family planning methods. Artificial family planning method. Number 1 is the chemicals, and the second one is the barrier. When you talk about the chemical methods, okay, it prevents ovulation. So you're familiar with this. These are the pills. These are the injectables, okay? These are the implants, okay? This is what we call your chemicals. It prevents what? Again, it prevents your ovulation, yes, okay? It prevents your ovulation, like your pills. Okay, we have 2 types of pills. You have the combined oral contraceptives and the progestin-only pills, okay? Combined oral contraceptives and the progestin-only pills. Remember, for the first 6 weeks after giving birth, okay, you can only use the progestin-only pills and you cannot use the combined oral contraceptives, okay? Okay, next, okay. I mean, after 6 weeks. That's after 6 weeks, okay? So that's called chemicals. And the next one is barriers. When you talk about barrier, the barrier method uses what? It prevents your fertilization. It prevents barrier, hinaharangan niya, okay? It prevents the egg from meeting the sperm, okay? So example, what is the best example? Can you comment? Is it allowed din? Okay? Okay. So don't comment anymore, okay? The example is your condom, okay? Your condom, okay? Your diaphragm, your IUD, your intrauterine device, okay? And others are your spermicides, okay? Those are your artificial family planning methods. And the last one is your permanent family planning methods, or the surgical one, okay? Okay, examples are BTL, bilateral tubal ligation, okay? Ligation for women, and vasectomy, okay? Cutting the vas deferens for male, vasectomy for males, okay? Some says it's actually reversible. Yes, but I told you it's permanent. Remember, you can only do the permanent or surgical methods if you're ready not to have baby anymore. Okay, remember that. Why? Because it's, as I told you, it's actually permanent. Some want it to be reversible. Like for example, magpapatali, okay? You want to be ligated, tali lang, okay? Not cut, okay? You will just want to tie it. And after you reverse it or you remove the tali, okay? What happens? Okay, you will be prone to what? Ectopic pregnancy, okay? So you don't need to do the permanent ones if you're actually ready, okay? not to have a baby anymore, and you want to enjoy life to the fullest, okay? So that is called informed choice. So I now mentioned to you the different types of family planning methods, and I hope you learn from them, okay? And the fourth one is what, okay? If you still remember, I asked you earlier, okay? What is the best time to get pregnant? Or when is the best time to get pregnant? Okay, the best time to get pregnant is when you want to have a baby. Why? Because if you get pregnant, or if you've had your family planning when you want to have a baby, then you become responsible parents. So the last one, the last pillar for family planning is parents are responsible or responsible parenthood. You enter parenthood, you make decisions, you make choices. Always remember that the choices that we make affects our future. Remember that. Now, let's go back to the 4 pillars of safe motherhood. Again, what's my mnemonics? Phase. The first one is family planning. The next one is A. It's called antenatal care. Okay? Antenatal care, also known as prenatal care. Antenatal care, also known as your prenatal care. So when we talk about antenatal prenatal care, what are these? Okay? So basically, one of the most important antenatal care is prenatal visits. When you talk about prenatal visits, check up, okay? Prenatal check up, okay? For all pregnant women, you are required to have check-ups, okay? This is one of the barriers. Later, we're going to talk about this barrier, right? Because during the pandemic, this is actually impeded, okay? So, and so check up. How many number of check-up is a woman required when she gets pregnant, okay? It's a minimum of 4. It's a minimum of 4. You have to be checked, okay? On the day or on the time that you know that you are pregnant, okay? On the time that you are pregnant, and then to the 6th, 7th week, okay? Or second trimester, okay? And then 8 months, and 9 months, okay? Those are the times that you have to get your checkups, okay? But the ideal setting actually is this, okay? Your checkup or antenatal checkup should be like this, okay? When you get pregnant, you have to do your checkup immediately, okay? For them to know and for you to know what to do in pregnancy, especially for first-time mothers. And you go back to the health professional, to the health center. If you want, it's okay. We have maternal services, okay? Next month, okay? Okay, as early as possible in pregnancy, and then next month, and then next month again, and then every month until you reach the age 8 months. And when you reach the 8 month, okay? 8 months, it's every 2 weeks. And on the 9 months, it's every week visitation already because you are excited and you are actually nervous, right? To deliver the baby. Those are your prenatal checkups. For a moment. Okay? That's your prenatal checkup. Okay, the next one is your multivitamins or supplementations. What are the supplements that we give to mothers, okay? Some supplements are vitamin A, multivitamins, okay? Also, vitamin A is very important, and iron with folic acid will be given to you. It's for you and for your baby as well. Okay, letter C. The next one is clean and safe obstetric care. Clean and safe obstetric care. So when you talk about clean and safe obstetric care, remember this, okay? It's actually you're giving birth, okay? You have to do it clean and safe. So you go to the hospital to deliver, okay? To deliver, especially when it's your first trimester or, sorry, if it's your first pregnancy or your 5th pregnancy, or if you're at risk, if you have other comorbidities or other conditions. And last is emergency obstetrics care. When you talk about emergency obstetric care, maybe you're familiar with this for the health workers. Emergency obstetric care, EMOC. You're familiar, right? BMOC, CMOC, yes. It's emergency obstetric care. It's preparation if an emergency situation happens during childbirth and delivery, and that is your emergency obstetric care. So you have your BMOC. BMOC means basic emergency obstetric care, and CMOC, comprehensive emergency obstetric care. To all the nurses or the students or those who are going to take the board exam, listening to me right now, maybe you're asking what is the difference between the BMOC and the CMOC. I'll tell you this as simply as this one. When you talk about BMOC, it's basic emergency obstetric and newborn care. It's done in the health center or the primary healthcare facilities or services given, like giving of administration of antibiotics, administration of certain drugs, okay, unang yakap, essential newborn care, and so on and so forth. Okay, but when you talk about comprehensive, it's done on a higher level facility which has to have operating room, okay? And that is the difference between the BMOC or the basic and the comprehensive emergency obstetric and newborn care. And those are the pillars, 4 pillars of safe motherhood. Okay, now, so I've given you a gist pa lang pala yun, okay? I've given you a gist of what maternal health and maternal health nursing is all about. Now let's talk about the novel coronavirus, okay? 2020 has been actually not quite a good year to all of us. Do you agree? Okay, so basically because of this, the novel coronavirus and so much happening, right? Started with the volcano and other disasters, okay? Now we have the novel coronavirus. Let's talk about some data. This is called a pandemic, which occurs with most countries, with many countries affecting most of the world, okay? It originated from Wuhan, China, province of Hubei on December 2019. And Europe became the next epicenter after China. And now USA has the most cases and deaths. And in the world right now, there are 213 countries and territories being affected. 34,508,082 cases with 1,028,028 deaths as of yesterday, 4 p.m. Okay, so that's a lot of people being affected. 1 million deaths being breached just this week. And in the end, but we have 25,684,678 recoveries. Now let's talk about in the Philippines. What's happening in the Philippines right now? The first case occurred in January 30, 2020 by a Chinese national. Okay, and the first death outside China occurred on February 2, 2020, which is the husband or the partner, okay? The partner of the first case, okay? And then on March 15, 2020, this is very memorable to all of you, right? March 15, 2020, okay? We entered the community quarantine or the extended community quarantine. This is the moment where our lives have been changed, okay? Those are the moments that we started staying at home for a very long time. I still remember, where were you during that time? Can you still remember? I remember that I was on airports during that time, traveling to the different parts of the Philippines to give my lecture to our review centers, okay? And we have 316,678 cases, and we entered the top 20 with the most number of cases. And probably today we're going to enter the top 19, okay? 16,678 with 5,616 deaths and 254,617 recoveries, okay? So we have a lot of recoveries, but still, there are so much cases here in the Philippines. So how do you know that you have novel coronavirus, okay? By testing, right? By swab testing, sorry, okay? So what are the clinical manifestations of the novel coronavirus, okay? So number 1 is cough, okay? You have cough, you have fever, you have shortness of breath, you have sore throat. They said that it was just a flu. It was just a flu. Then I would like to ask them a question. If it was just a flu, then what is 1 million deaths already? Why do we have 1 million deaths already, okay? And aside from this, you also have diarrhea. Diarrhea, and another thing is loss of taste or smell. And those are some signs and symptoms of the novel coronavirus. I should know, okay? And what is the Philippines doing right now? Or what can we do to prevent novel coronavirus, okay? Or how to prevent the outbreak? Of course, hand washing. The best way to prevent it is hand washing. Always do hand hygiene, hand washing. So kills coronavirus. Next is the wearing of face mask. And now the wearing of face shield as well. What else? Physical contact. So avoid places with many people. That's how to prevent. So what is the Philippines doing right now? Or what are the protocols to be followed for the novel coronavirus, okay? The first one is community quarantine. That's why we stayed at home. Mass testing for we to know who are positive and who are not. So we can do contact tracing, okay? Contact tracing to check who have been in contact with the person who has positive, who have been positive with the virus, and then isolation precautions for the positive ones, and of course the creation of the interagency task force of the Philippines. Okay, so I have a quotation here. It says here, it's a wonder how nature can change everything from the ways of lives to the loss of it. Yes, actually that's my quotation. And what happened next? People stay at home. Offices, malls, and parks are empty. Schools become virtual. That's why we're here right now. Masks and shields become essential garments. Physical contact is avoided. Hospitals are overwhelmed. And what happened to nurses? Nurses and other health workers become heroes, but are feared. Yes, we are heroes, but there is so much hate crimes, hate incidents to nurses. I think one thing we have to do, nurses, we have to upright our rights, okay? And we have to stand up for it, okay? And for all the people listening right now, please care for the carers. And in that way, because of COVID-19, we entered the new normal, okay? We entered the new normal, and this is the new normal. And actually, we have to coexist with the virus. We have to live with it, okay? It's going to stay with us. What we do is we coexist with the virus, okay? Now, let's move on to our next part. Filipino women and mothers and COVID-19. So, let's talk about some, again, Filipino women and mothers and COVID-19. Let's start. Okay, so what's happening right now? Less accessible maternal services. Yes, okay? According to the Interagency Task Force, IATF, who are the people who cannot go outside their homes? Yes, who are? Below 18 years old. Who else? Those who has comorbidity, may sakit. Who else? Senior citizens and the pregnant mothers. Then how can pregnant mothers be checked if they cannot go outside? See? So there are less accessible maternal services. What else? Mothers as household caregivers. Well, even without the pandemic, mothers are household caregivers. Pag nagkasakit ba yung anak nyo, sino ba yung unang mag-aalaga sa kanila? Of course, the mothers. So if someone gets sick, the mothers will get to take care, even with those positive with COVID-19, right? And then heightened vulnerability to violence against women. Why? Remember, what happens in the new normal? People stay at home. So you stay with your family. Yay! It's happy, right? Not all families are happy because of that. Why? They don't have jobs. So what happens next? Nagging. They're going to fight for it. What happens next? Okay? They're going to nag, they're going to fight. And what happens next? Violence against women and children. Okay? According to studies, okay? Yes, reported cases are actually lower in the Philippines, but those unreported cases are high. They are not, maybe they are not reporting. Remember this, for those who are experiencing violence against their domestic partners, okay? You have to stand up for your own right as well. As women, you have to say, you want women empowerment, you empower yourself. You start with yourself. Remember this, okay? Abusers can only abuse if they are being allowed. Sometimes you have to fight back, okay? Fight back, not to fight and punch, okay? But you have to fight back, not only for yourself, but also for your children. Some women are actually holding their family or just keeping with it, just letting the abuse happen because they want to save their family. You want to save your family. Then I have to ask you a question. Is that the family that you want your children to see? Is that the family that you want your children to live with? So if not, you know what to do. You have to wake up, girl. Okay? Heightened vulnerability to violence against women and children. So I would like to ask you a question. For those who are mothers or father here, okay? What happens after a fight? According to nursing studies about women abuse, the next phase after the battering wife syndrome is honeymoon, right? So there will be unplanned pregnancies and birth complications, okay? This is one of the biggest effects of COVID-19 to mothers, okay? The unplanned pregnancies and birth complication. And lastly, for women, become poorer, right? They don't have jobs and become poorer, okay? Who gets rich right now? Those who are getting advantages, members of, okay? So poor women become poorer. COVID-19 pandemic impact on women, according to the UNFA, okay? According to the UNFA and the UPPI, okay, the population organizations. So let's talk about this ones. Okay, the effects of COVID-19. UNFA stands for United Nations Population Fund Association, and UPPI is University of the Philippines Population Institute. Okay, so effects of the COVID-19 on Filipino women's and girls' sexual and reproductive health and freedom from violence. Okay, let's look at it. Okay, number one, first impact, delivery and access are being diverted, right? Because of what? Service disruption. Okay, so we are caught off guard because of the pandemic, so there is a service disruption. The next one is difficulty in commuting. Who wants to commute right now? Actually, I'm actually afraid to commute right now. Okay, so also the other women are as well. And of course, fear of contracting COVID-19. Next, what else? Filipino women of reproductive age, ages 15 to 49 years of age, who do not use any contraception, though they do not want to become pregnant, can also increase by 2.07 million. This is actually a projection by the end of 2020, which is a 67% increase from 2019. Remember, 1.6 million births in 2018, right? 2018, right? And now we are projecting 2.07 million for 2020. And if this pandemic continues, according to the study, the unintended pregnancies will increase up to 2.56 million. That's 751,000 more pregnancies for it to increase from 2019, okay? So health workers, get ready. Okay, hospital administrators, get ready your delivery room and labor room, because we're expecting more pregnancies this year and next year as well, okay? So what else? That is, and of course, 20% increase of intimate partner violence is either physical and sexual by the end of 2020. That's from 2019. Okay, so let's talk about the interim guidelines. Interim guidelines on the continuous provision of maternal health services during COVID-19 pandemic. So what is the DOH giving, or what do they advise the health practitioners or the health workers to do during this pandemic? Okay, so let's look at what's happening right now. Let's start. Strengthening health system response within the healthcare provider networks. Okay, so we will strengthen health system. Now, how can we do that? Designation of facilities where COVID-19 and COVID-19 pregnant women can access maternal health service, including delivery. Okay, to all the pregnant mothers out there, there are still facilities which you can check. You can contact. Okay, if you have numbers of your health centers, you can just call them, so you cannot go outside. Okay, and check or what facilities can you go. Okay, there are facilities for the positive ones and the non-positive ones. Okay, the primary care facility shall serve as the main navigator or first contact and determine the appropriate facility for suspect, probable, and confirmed COVID-19 pregnant patients. Oh, the primary healthcare facilities are your health centers, RHU, okay, the community hospitals, okay, which you can actually go. And usage of telemedicine. Telemedicine is important right now. We have contact numbers from the DOH, which you can check, okay? So in the internet, so you can call, okay? So you will not be obliged or obligated to go outside, okay? Next is strengthening healthcare. Again, this one of the strengthening healthcare system response is non-refusal arrangement, coordination and arrangement in BMONC and CMONC. Remember BMONC and CMONC for emergency cases. The basic and comprehensive facilities shall not refuse any pregnant mothers of service. Remember that, okay? That's written on the interim guidelines by the Department of Health. Okay, strict adherence to referral protocols, and all pregnant women who are about to deliver and those who have delivered but manifesting signs of complication shall not be under any circumstances be refused admission by the health facility. However, okay, there's a non-refusal protocol. However, infection control protocol shall be strictly followed. So make sure you wear face shield, you wear face mask, and if you want to wear PPEs, if you have one, wear it, okay? And that is your personal protective equipment. So what else? So the next one is to ensure continuous provision of maternal health services. So some are asking, when COVID-19 outbreak has become pandemic in the epidemic in the Philippines, then what happened to the other health services? It is actually continuous. So there are still health services, especially for mothers, and these are antenatal, delivery, and postpartum care services for low-risk pregnant women, and they will be facilitated with the BMOC. Remember, in the primary health centers, okay, in the basic emergency obstetric and newborn care facilities, while those with high-risk pregnant women shall be referred to the CMONC. Take note of this, okay? Okay, those with low risk, be referred to BMOC, and high risk will be referred to the comprehensive emergency obstetric and newborn care facilities. Okay, next, ensure continuous provision of maternal health services. Okay, if referral to CMOC may pose further risk to the patient, if ever there is a difficulty or problem, okay, going to the CMOC referral facility, then BMOC facilities may cater patients regardless of their parity, as long as a pregnant mother has no comorbidities, provided the following condition. Again, pwede pong tumanggap ang mga primary healthcare facilities, okay, as long as na walang ibang sakit your mother at meron siya ng mga sumusunod na conditions. Number 1, BMOC trained physician is present. Okay, next, emergency transport vehicle is on standby if ever something happens. Okay, and referral hospital is available in case of emergency complications. So you can easily refer our patient or client. Next, healthcare workers in public and private clinics shall continue to provide antenatal, delivery, and postnatal services with strict adherence to infection prevention and control measures, including but not limited to this other protocols, okay, by the IATF and the Department of Health. Number 1, temperature checking and assessment for signs and symptoms prior to entry, so we can actually triage. And for those who are pregnant mothers going to health centers, please, wag na po tayong magsinungaling. Kung may nararamdaman tayong masama, sabihin na po natin agad, so we can actually save the lives of ourselves, our family members, and the health workers, okay? May mga, ang dami nang namatay na mga health professionals because of that, okay? Sabihin na ba, masakit po yung lalamunan ko, or, di ba? Temperature checking and assessment for signs and symptoms prior to entry. Of course, frequent hand washing. Proper cuff etiquette, okay? You cuff on your shoulders, on your elbow, okay, or with handkerchief, or with the mask, okay? Next, wearing of appropriate PPEs or personal protective equipments, social distancing, and, okay, sterilization or disinfection of frequently touched surfaces. What else? Okay, the last part of the interim guidelines on the continuous provision is maximizing teleconsulting and teleprescription platforms for antenatal and postpartum care, okay? So some doctors are having changes or adaptation already for the new normal because they're actually looking into doing internet consultations, okay? And they're giving prescriptions through the internet as well, okay? So what do? They are actually consolidating and harmonizing current teleconsulting or teleprescription platforms available within their networks. If none exist, then HSCPNs, okay, or the healthcare network shall organize healthcare professionals in the network to develop a mechanism for interim telehealth solutions. And I hope you have it right now in your own community as well. So service provision according to COVID-19 status of pregnant women. So this is what we're doing right now. The type of patient and the recommended facility. Let's start. When you talk about for all the pregnant patients, again, for all the pregnant patients, they will be referred to the, you have to go, okay, the primary care facility for triaging, for prioritization via telemedicine if possible. And for the asymptomatic pregnant with close contact, just tell them you have a close contact, but you don't have a symptom. You have to do home quarantine for 14 days, home quarantine for 14 days, or temporary treatments and monitoring facility for quarantine for 14 days. So you'll be going to be referred to the isolation treatment facilities, okay? And if you have a mild symptoms, or you're asymptomatic pregnant and you're mild, okay? And you'll be classified as suspect, probable, or confirmed case, but you have mild symptoms, you're going to do the following, okay? Temporary treatment and monitoring facility for isolation for 14 days, or level 1 hospital, or hospitalization provided with clearance from the patient's attending physician. Okay, again, so remember those: for symptomatic, temporary treatment, level 1 hospital or infirmary, and hospitalization provided with clearance, okay, or hospital isolation or home isolation. Okay, next, for symptomatic pregnant or severe or critical. If you have critical and you're pregnant and you're classified as a suspect, probable, or confirmed COVID-19 case, you will be referred to the COVID-19 referral hospital or COVID-19 accepting level 2 or level 3 hospital because you are severe, you are severe or critical already. And for those who are clinically recovered pregnant women, or if you're suspect, probable, or confirmed, awaiting completion of quarantine period, and you think you are recovered, then remember, you're going to be referred to a level 1 hospital, infirmary, or temporary treatments and monitoring facilities selected for step-down care. Again, okay, those are the classification or the service provision according to COVID-19 status of pregnant women according to interim. Okay, last, according to the interim guidelines, the risk stratification to guide services provision among pregnant women. Okay, antenatal care means you are pregnant, you want to do prenatal checkup. Okay, and delivery and postnatal is if you are about to deliver or you have given birth to your child. For low-risk pregnant women, for the prenatal or antenatal care, it will be provided by primary healthcare facilities such as barangay health stations, rural health unit, lying-in clinics, birthing homes, and your district hospitals, okay, for antenatal care. And for delivery and postnatal care, you can go to the BMONC facilities such as RHU, okay, rural health unit, DOH, licensed birthing home and infirmary within the healthcare provider network or the HCPN, okay? And for complicated cases, refer to CMOC, okay? Or Comprehensive Emergency Obstetric Newborn Care Facility, which are DOH license levels 2 and 3 general hospitals or Apex hospitals within the healthcare provided network. Those are for low-risk pregnant women. Okay, but for high-risk pregnant women, okay, like for example, who are the high-risk ones? Gravida 1, this is her first pregnancy. Gravida 5 or more, this is her fifth or more pregnancy. And those who are pregnant with comorbidities like heart problems, diabetes, COPD, and other conditions, okay? For the pregnant ones, it will be provided with the primary health care, okay, as I've mentioned. And for emergency, it will be referred to the CMONC facilities again, okay? But for delivery and childbirth, okay? Okay, for high-risk pregnant women, provided by CMONC facility DOH license level 2 and 3 within the healthcare provider network. And if referral to CMONC, this I mentioned to you earlier, right? Okay, if CMONC is not applicable or it will pose a risk like the length of time or the travel or the problems, okay? Usually the BMONC facility must have the following, okay? The BMONC trained physician, emergency transport vehicle, and standby, and referral to a hospital is available in case of emergency complications. And remember this, for high-risk women, for complicated cases, refer to regional CMONC facility within healthcare provider networks. Okay, so that is your interim guidelines for the Department of Health. Now, let's talk about the maternal nursing care updates, Lippincott Nursing Center 2020. So these are what you need to know about maternal nursing care during the COVID-19. I think this is the last part of our maternal updates, okay? So let's continue. Start. For prenatal care, for pregnant women, sa mga buntis na nandiyan, for prenatal care, okay? Spacing out appointments. So you have to set your appointments to them. And when you say spacing out, you have to give time, okay? From the first one to the next one, okay? If it's face-to-face or in need of face-to-face, okay? Alternate or reduce prenatal care schedules. As I told you, okay? The ideal is monthly, okay? Is monthly from the earliest time that you know that you're pregnant, but you can have it for the minimum of 4, okay? Grouping components of care together to reduce the number of in-person visits, like grouping them or scheduling them. Phone and telehealth screenings before in-person visits to assess COVID-19 exposure or symptoms, okay? So that's prenatal care. What else? Prudent use of ultrasonography and avoidance of elective ultrasound examinations. So we're just going to use ultrasounds, okay, if the mother needs it, okay? Postponement, or listen to me, or for those who are going to take the board examination, listen carefully. Postponement or cancellation of some testing or examination if the risk of exposure and infection within the community outweighs the benefits of testing. So if there's a very high number of positive cases there, we can actually postpone or cancel your checkup or examination if you're not high risk, okay? So we're going to wait as health professionals, okay? So what do we do for pregnant mothers with COVID-19? Again, we're dealing with pregnant mothers, okay? Pregnant mothers with COVID-19, detailed mid-trimester anatomy ultrasound following first trimester maternal infection. So we're going to check if it's, because honestly, okay, according to research, okay, there are no lots, okay, of research being done right now as of the moment. So we're just dealing with what we have right now, the initial data, and we're still looking into it. So detailed mid-trimester, in the second trimester, if you are positive during the first trimester with COVID-19, okay, you have to check a detailed mid-trimester anatomy ultrasound and ultrasound for fetal growth in the third trimester for women who have experienced COVID-19 later in pregnancy. So we can actually check the actual status of your baby, okay? So what else? Pregnant mothers with COVID-19, okay? The giving, this is one of the research. What is that? Okay. There's one thing about research about giving antenatal corticosteroid use. Remember this, okay? Because in the prescription of antenatal corticosteroid use, okay, according to studies, corticosteroids are not given, okay? Corticosteroids are not actually given to patients with COVID-19, okay? They're not given to patients with COVID-19 because it poses a risk with for those who are being affected with MERS-CoV before and SARS before. Ayan. So for pregnant mothers, between 24 weeks, okay, and 33 weeks of gestation at risk of preterm birth within 7 days, antenatal corticosteroids should continue to be offered as recommended. Okay, meaning to say, if you're not a pregnant mother, okay, corticosteroids are not actually given. But okay, if the mother needs it, okay, it should be continued to be offered as recommended. And between 34, okay, 34, remember the date, okay? 34 weeks and 36 weeks of gestation, it should not be offered, okay? 34 to 36 weeks, it should not be offered to pregnant mothers, okay? Now, let's talk about the mental health support for mothers. Of course, we have to support the mothers. So what are these, okay? The first one is counseling related to, okay, we have to counsel the mothers, communication with the team, okay? So they know, because mental health status is something that affects all of us, not only pregnant mothers, right? Some of you are feeling depressed. For no reason, you're feeling some sort of sadness or questions about yourself, right? So these are the things that we can actually do, not only for them, but to all of us. Number one is communication with team, like changes to labor and postpartum plans. We have to ask them that. Visitations, okay, about visitation and postpartum contraception. So we can prepare them after. Okay, intrapartum care for the pregnant mothers. So when a pregnant patient with suspected COVID-19 or confirmed COVID-19 is admitted and birth is anticipated, the obstetric, pediatric, or family medicine anesthesia team should be notified. Remember this, if a pregnant mother is positive, we have to notify, okay, the doctor immediately. It is reasonable to attempt to postpone delivery. Remember this. If no other medical indications arise for a woman with, if you are positive with COVID-19, okay, okay, must postpone. It is recommended, okay, to postpone the delivery, okay, after a negative test results. Meaning to say, if you're pregnant, you get positive, as long as it's you're not in labor, let's postpone the delivery, okay? Let's postpone the delivery. And then cesarean delivery should therefore be based on obstetric indication and not COVID-19 status. Meaning to say, not because you're COVID-19 and we're going to conduct a cesarean delivery, okay? It still depends on the need of the mother. Decisions related to labor, inductions, and cesarean deliveries should be made at the local and systems level based on healthcare personnel availability, geography, access to readily available local resources, and coordination with other centers, okay? Meaning to say, if you want to know induced labor or cesarean, we have to check the healthcare facilities that we have right now kasi baka mabigla rin naman tayo, di ba? Okay, you check your personnel, the availability of resources, and other centers like referral centers. Delayed cord clamping. Listen to this. Delayed cord clamping is appropriate in the setting of appropriate clinical personal protective equipments. Okay, what is the standard guidelines for cord clamping? The standard guidelines is you have to wait for the pulsation to stop, right? You have to wait for the pulsation of the cord to stop, then cut it, right? Okay, or 1 to 3 minutes after birth. But here we have to delay cord clamping, so you have time to do clinical personal protective equipment, or to change your gloves from touching the mother to touching the baby, okay? Delayed cord clamping, okay? When mother and infant are healthy, it may be appropriate to expedite discharge. So if they're healthy and they don't have COVID-19, you would expedite discharge. And decision regarding early discharge will require input from the pediatric team, and home telehealth visits for the mother and infant should be considered. And after going to the hospital, of course, in the Philippines, you're going to follow the protocol of 14-day home quarantine. Okay, let's talk about vertical transmission. Okay, what is vertical transmission? It is a transmission of a pathogen from a mother to her fetus or newborn before, during, or immediately after delivery. Okay, so this is a question. Okay, kapag babuntis ka, automatic yung anak mo ay magkaka-COVID-19 na rin? What do you think? I'll repeat my question. Kapag babuntis ka, kailangan yung anak mo, or automatic yung anak mo ay magkaka-COVID-19 na rin? Okay? So let's talk about this, okay? Some pregnant women with COVID-19 have had preterm births, but it is not clear whether the preterm births were because of COVID-19. Meaning to say, there are no specific data that kapag may COVID-19 ka, na magiging preterm yung baby mo, okay? There's no data about it, okay? No clear data about it, okay? It's also not clear if COVID-19 can pass to a fetus during labor and delivery, meaning to say, okay, there's no data, okay, that it can be passed through during labor and delivery. So, pwede yung anak niya ay hindi mag-positive sa COVID-19 kasi may ganyang mga cases na yung nanay positive, yung anak niya is hindi naman positive sa COVID-19. Neonates born to affected mothers na may COVID-19 and amniotic fluid, cord blood, and breast milk were negative for SARS-CoV-2. O, yun yung virus ng COVID-19, right? Meaning to say, again, I'll repeat, okay? Amniotic fluid, okay, cord blood, and breast milk were negative for SARS-CoV according to research by Chen et al., okay? What else? 3 of 33 infants, or 9%, presented with early onset of SARS-CoV infection, which resolves by day 6 to 7, okay? During the early times of COVID-19, we can see that actually, in the early times, ngayon meron na okay? There is 0 mortality rate for infant, right? So mga batang 0 to 9 years old, sobrang baba na namamatay, and na-resolve daw agad within 6 to 7 days ang COVID-19 sa isang infant. Probably with the antibodies of the mother. Later, we'll talk about it, okay? In these cases, the likely sources of SARS-CoV-2 in the unit's upper respiratory are anesthesia. So meaning to say, if the child acquired COVID-19, okay, it is maternal in origin. It's maternal in origin. Nakuha niya nung nilalabas siya or pwedeng sa gloves ng health practitioners, okay, or in the air, okay? However, the vertical maternal fetal transmission cannot be ruled out. So, hindi pa rin natin sinasabing hindi pwedeng mapasa, okay? Pero, may positive na, may hindi, okay? Therefore, screening of mothers and close monitoring of neonates are at risk are essential. Meaning to say, for pregnant women, it is a standard, even in the Philippines, that we have to check for the COVID-19 status of them. Even with other procedures naman in most hospitals, right? Before any procedures will be done, okay, you will be tested or will be swabbed the COVID-19 test, okay? Okay, are you learning right now? I hope you're all learning right now. So can you please have a heart, comment, or have a smile again, okay? So let's talk about infant care for COVID-19 positive mothers. Infants should be isolated according to the infection prevention and control guidance for PUIs, okay, persons under investigations, okay? Isolation. What else? Facilities should consider temporarily separating the mothers from her baby. Again, temporarily separating the mother from her baby until the mother's transmission-based precautions are discontinued. This is according to Lippincott, okay? And discharge for postpartum women should follow recommendation described in the interim consideration for disposition of hospitalized patient with COVID-19. It depends on the hospital protocols and in the government protocols as well. So, according to the World Health Organization and the DOH in the Philippines, okay, question, okay, let's talk about the unang yakap, okay, unang yakap. Will the unang yakap be facilitated during COVID-19? Okay, unang yakap gives much benefits to the child. So, I have a question to all of you, okay. Is unang yakap important or can it be done during the COVID-19? I want your answers. Please comment in the comment section. Can unang yakap be done na COVID-19 mothers? Okay, let's see. What is unang yakap by the way? We have a guest. Okay, what is unang yakap by the way? Okay, unang yakap, we have 4 steps of unang yakap. The first one is immediate and thorough drying. Okay, immediate and thorough drying. Okay, immediate and thorough drying. So after the giving birth, you dry the baby, okay? Within 30 seconds, okay? Within 30 seconds. And after that is early skin-to-skin contact. That's unang yakap, okay? The mother hugs the child, okay? And then properly timed cord clamping, This is unang yakap. I'm not discussing it the COVID-19. Okay, wait for a moment. Properly timed cord clamping. The standard is, I told you, that's 1 to 3 minutes cord clamping. You wait for the pulsation to stop. And breastfeeding and grooming in. Okay, now, okay, we can see immediate and thorough drying. Yes, check. Okay, it can be done. Okay, it can be done in the new normal. Next, properly timed cord clamping. I mentioned that already. Can we do it? I have a question. Do you remember? For properly timed cord clamping, are we in COVID-19? Okay, in COVID-19 positive mothers, are we going to wait for the pulsation to stop? Yes or no? The answer is no. We're going to delay it, right? Okay, because COVID-19 is not present in the cord blood, okay? So it's not being transferred, okay? There's a barrier right there. That's how, see how good God works, okay? And then, so right now, I have a question. Can we do early skin-to-skin contact? Okay, can we do early, ask yourself, can we do early skin-to-skin contact to a positive mother and a child? Or can we do breastfeeding and rooming in? Okay, so it follows, right? If you're not going to do skin-to-skin contact, you're not going to breastfeed. So if you're going to do early skin-to-skin contact, you can continue to breastfeed because, as I've mentioned to you, it is not found in breast milk. Okay, based on the studies right now. So are we going to promote it? So let's look at the next slide. Okay, into-skin contact and breastfeeding for COVID-19 positive mothers, the World Health Organization recommends continuing immediate skin-to-skin contact. May unang yakap pa rin po and early and exclusive breastfeeding during the COVID-19 outbreak as the benefits substantially outweighs the potential risk of transmission and illness associated with the disease. Okay, so this is not actually ruled out, but they're saying that the breast milk antibodies gives protection to the child. Okay, see, so continue breastfeeding for the, but they have to follow strict protocols. Okay, so what are the protocols? Okay, breastfeeding and COVID-19 positive mothers. So this is what you have to do for pregnant mothers who are positive with COVID. Kung mag-positive man sila, ito yung gagawin nila. Number 1, washing your hands before touching your baby. Of course, this is provided you're wearing face shield, face mask, or personal protective equipment. Okay, wear a cloth, face covering if possible while feeding at the breast, and wash your hands before touching pump or bottle parts and clean all parts after each use. Okay, this is from the CDC, Communicable Disease Control. Okay, 2020. Okay, so breastfeeding during the COVID-19 pandemic. Are we going to do that? Yes. Okay. Continue to breastfeed while taking care with hygiene. Just with the 3 W's. The first one is this. Okay. The 3 W's. Wear a mask during feeding. Okay. For breastfeeding. Okay. Wear a mask during feeding. Wash hands with soap before and after touching the baby. And wipe and disinfect surfaces regularly. Okay. So mothers can still breastfeed. Yes, according to UNICEF 2020. Okay, what else? Take additional hygiene measures and continue to breastfeed if you fall sick. Okay, so if ever, okay, that you are not positive, okay, or this is actually in general. This is in general for everyone, not only for positive mothers, for everyone. You do this. If you want to breastfeed, what else? Take additional hygiene measures and continue breastfeeding if you fall sick. Use a cup and spoon to feed babies with express breast milk when too sick to breastfeed. So, unless okay, you have diseases which cannot breastfeed, because we have yes, COVID-19 can breastfeed, but remember there are mothers who cannot breastfeed, like HIV, Hep B, CMV, and TB, tuberculosis. Okay, and take extra care when formula feeding, but breastfeeding is still best for babies up to 2 years. Okay, so next, okay, for the last update. Okay, for the maternal health, mental health and psychosocial support to mothers. Mental health and psychosocial support to mothers. First trimester, what do we do? It's actually accepting the baby. Why do I have to present you this? We have to give the support to mothers. Why? Us, okay, or the community people, right now we're dealing with our own mental issues, right? We're being sad, we're being depressed for no reasons at all, right? And sometimes being happy is actually hard, okay, at certain times. So what more pa yung mga pregnant mothers, they're experiencing so much hormonal changes. So pinanonood man yung mga asawa dyan, yung mga anak, if you have your mother or your sister or somebody at home is pregnant, and let's try to understand them. Okay, let's try to understand them. Why? Okay, this is the psychological task of pregnancy. Both the women and their husband walk through a tangle of emotions during pregnancy. Accepting that a new life will be born out of your blood is not easy, as others may think. There are general stages that both should undergo the psychological way. In the first trimester, the main task of a mother is accepting the baby, right? Sometimes you have shock, okay, especially in the pandemic, right? You're dealing pandemic and you get pregnant because of the barangay hall, right? Okay, and then So, and another thing is you feel ambivalent. You're both happy and unhappy. Okay, you're pleased and sad about the pregnancy because you don't know what's going to happen. You're going to get pregnant at the middle of the pandemic. So let's try to understand all of them. Okay, in the second trimester, excuse me, okay, you have to accept the pregnancy. The woman and her partner will start to merge into the role of novice parents as the second trimester closes in. Their emotions such as narcissism, okay, the mother wants to take care of herself, and introversion are commonly present at this stage. And at this moment, they want to do what? Role playing, right? And increased dreaming or activities that help the couple embrace their role as parents. And actually, during this time, there's actually increasing libido for the mothers. Okay, this is a moment that they want to do it again. Why? Because this is the moment that you feel that you're changing your appearance. Okay, you feel that you're getting ugly, so you want to please your husband by doing it again. Okay. And at this stage, the woman and her partner must start to concentrate on what it feels like to be parents for those first-time parents. And third trimester is preparing for the baby. Okay, you have the couple starts to grow impatient as birth nears. Ito yung moment na sana lumabas na yung baby, di ba? And preparations for the baby, both small and big, takes place during this stage. The baby's clothing and sleeping arrangements are set, and the couple excited for this arrival. And during the pandemic, yes, normally we'll get excited, but during the pandemic, we felt nervous as well and feared. Why? Okay? Feel fear. Kasi nakakatakot baka makahawa pa yung COVID-19 sa ospital. But remember, in the hospital po, mas magandang hospital pa rin po magbigay or mag-give birth to mothers. Okay? So what else? So mental and psychiatric support to mothers in the pandemic. Let's support the mothers in this pandemic, and let's support everyone. Let's support each other during the pandemic. Okay? So maternal depression and anxiety prevalence rates appear elevated during the COVID-19. Depressed mothers, anxiety, prior psychopathology, poor marital quality, and financial strain affected the risk. Okay? Mas nare-risk daw yung mother kapag yun, yung may problema sa asawa. Kaya huwag nang pasakitin yung ulo ng mga buntis. Okay? Mothers primarily obtained mental health information through online resources. O, di ba? Research na lang sa online, no kayong pwede kong gawin. Ganun. Okay? So what do we do? For mothers, the first one is self-care, okay? New mothers need to recover from the physical and emotional challenges of pregnancy and childbirth. Being a new mother, caring for a newborn, and maintaining home and family is challenging, right? Especially if the mom feels anxious or depressed. Moms, as much as possible, should focus on what? Number one, okay? What did I tell you, okay? Number one is sleep, okay? Getting 4 to 5 hours of uninterrupted sleep is the most effective. Okay? Normally, di ba, 9 hours sleep for pregnant mother, okay? 45 hours at least, di ba? Gising-gising yung mga mothers, di ba? Least expensive thing a new mother can do to start feeling better, passing off. Just one night feeding can help a new mom get this long, especially sa mga nanganak na during the pandemic, okay? Of course, nutrition. New moms can try to eat every time baby eats, okay? Ayan, you eat more, okay? Eat nutritious foods as well, okay? Okay, try stocking a feeding station. Saka huwag niyong lait-laitin yung mga buntis na, oh, you're pregnant, you're getting fat again. Okay, let them eat, okay? Because they need 1,000 more calories than a normal person do, okay? And then is exercise. Gentle exercises, walking is best for you, okay? And then, of course, time off, okay? No other job is demanding, requiring being on duty 24 hours a day, 7 days a week, than a new mother, right? Okay, self-care, and of course, social support. Let's support all of them, and talk therapy and counseling. And of course, talk therapy is talk to them. You can hire a counselor, but actually friends, families, fathers, okay, can help a lot, okay? Let's talk to them. Let's try to understand them. Try to learn that word, okay? Understand, okay? And of course, medication. One thing I want to give all of you, okay? When they are nagging because of their hormones, especially to the fathers out there, one thing you have to remember, put it in their minds, okay? Just answer them with gentleness. Try to be gentle. When you're making the baby, you're very gentle, right? When nung sinusuyo mo sila, gentle mo. Right now, you try to be gentle to all of them, okay? And the gentle answer can remove the wrath, remember, or the anger of a person, okay? Huwag mong sabayan kasi magagalit kayo pareho. Or sometimes just be silent. Tiisin mo na lang kaya, okay? Ganon. Okay? So we're done with our main topic, and now for my last topic, so those are topic for maternal health, and I think I'll give much time. Thank you for staying with us right now, and I hope you're learning right now. Now, this is something that I wanted to share to all of you. This is actually enabling and excuse me, enabling and empowering nurses and the community. Okay, so I don't just want to enable the nurses, but I want you to learn nurses. I want you to learn from this. But the community, they have invited community people. That's why I have reduced, okay, some terminologies, or have given you some thoughts on it, or I'm continuously repeating my words so they can actually understand. Okay, sorry if I'm speaking in the foreign language, because some of our listeners are from China. Hello for my classmates in China and Nigeria as well, and other international students. So I hope you understand. And if you want to watch the video again, just visit PWU Facebook page. Okay. So how to enable and empower. So what is enabling? It is making someone do something challenging. Like for example, if I want you to do something challenging, it's called enabling. I let you do it, okay? I challenge you. It's called enabling. It's challenging somebody else. What is empowering? Excuse me. Empowering is teaching others to do it for themselves. What's the main difference? Enable is you challenge them. You let them do it. They're enabled to do it. But empowering is they do it because they wanted to do it to themselves and they learn from it, okay? So empowering is to provide the path for people to discover their own ability. So when we are empowered and when you empower others, they discover their own ability, that they're good, okay? That they're actually good, okay? I think there's one thing I really learned from Dr. Carl Balita, okay? I'm with CBRC for a decade right now, and you've heard it in my introduction. And I think Sir Carl empowered us a lot, okay? He doesn't take all the credits alone, but gives to the other people. And that's one thing I think Asia CEO Awards saw in all of us, because we are actually empowered to do things to make a difference in this world. And when you are empowered, even in a single thing, you can change your lives and you can change yourselves. Okay, so leadership. Empowerment is all about leadership, and leadership is the ability to influence. Okay, I hope I'm making sense right now. If you're really inspired listening to me right now, I know I'm showing what? The leadership in me right now, okay? And I want to thank at this moment HSCO Award for hailing me as the Young Leader of the Year, okay? For a circle of excellence. And maybe it's all about the influence that we can share to other people. And I hope it's not only coming from me, but coming from you who are listening right now. Okay, enabling and empowering nurses in the community. Okay, these are the following thoughts. Okay, authority, responsibility, and accountability. Remember, when you are enabled, when you are empowered, you have these three powers: the authority, the responsibility, and the accountability. Remember this: when you empower other people, you give them the authority, the decision to do things. Okay, but remember this: you share the responsibility while they are doing what you want them to do. Okay, you share the responsibility. And remember, you might share the responsibility, but who is accountable? It's still you, the nursing leaders, the nurses, okay? Or the people. You're still accountable to what you delegated to other people. Remember that, okay? Okay, you might transfer authority, but you share responsibility, but remember that you retain accountability. Okay? So, how to enable and empower other people? You start with the domains of a person. The first one is knowledge. Start with the mind. Start with yourself. How can you enable or empower other people if you don't have it, right? Oh, as an educator, you cannot teach what you don't know. Like for example, they are giving me the topic legal basis of educate nursing, okay? And I told them, I think I better be talking on business, marketing, or maternal and child or community health nursing. And I tell them, because that's what I am empowered for, right? Empower your knowledge base, okay? Knowledge is power. Just learn more. This is one thing I want you to know. If you don't know something, learn more. That's it, okay? If you don't try to learn more, okay? During the pandemic, what have you learned more, right? Have you learned something else? Have you done something new for yourself? See, you have to increase your knowledge, okay? The next one is skills, okay? You empower to the knowledge, you empower to the skills, okay? Start with yourself, okay? Do it yourself and you let others know it, okay? As nurses, okay, you need practice. How to be good in skills, okay? In the clinical laboratory, you have to be very, very good in skills, right? Okay, how can you do that? Practice, do it continuously, okay? I can tell you that most of you listening right now are better to me in other skills, Like, for example, catheterization. I have a given catheter, but some of you nurses, registered nurses here, have given catheter to 1,000 urethra already, okay? Or those in Pabella right now have saw or have given birth to 1,000 vaginas already, right? Okay, and that's skills. And the last one is attitude. Okay, attitude, changing yourself. Start with yourself. Okay, if you have this and you're good in skills, but you have a very wrong attitude, then it doesn't follow. Remember that. You might be the most intelligent person in the world, but you have the worst attitude, you're not going to get far. Remember that. You have to have a good mindset. You have to have a good emotional skills. You have to have a good value in general. Okay? You have to have a good value in general. And that's called attitude. You have to change your attitude. Okay? Start with yourself. Then you empower others. That's how you empower people. Okay? Now, so enabling, empowering, let me just show you the process of empowerment and enabling. Okay, this was just very, very quick. Okay, start with the trust, build trust. How can you build trust? Through two words: honesty and integrity. Okay, honesty, no truth. Trust, that's how you build trust. How can you build trust? Okay, trust is built on consistency. Okay, when you're always consistent to other people, to your people, okay, they will trust you consistently. Okay, but if you keep on lying, there's no trust. And the first one is honesty. The second one is what? Integrity. What is it, integrity? Integrity for me, I define this as transparency. Transparency to yourself and transparency to other people. Yung wala kang tinatago, yung ikaw yun, nasa harap at nasa likod. I think most people right now is losing their integrity, right? Build your integrity, okay? It pays a lot, okay? Yung darating ang point na hindi mo na kailangan, huwag mo sasabihin kay ganyan. Be transparent, and that's called integrity, and that's how trust works. You will be trusted if you have honesty and integrity. The next one is relationship. How can you build relationship? Through connections, through an open connections, and through what? Understanding. See, if you have trust, you're going to build relationship, and with relationship you're going to have clear communication. I cannot communicate with my people. If that's your problem, then you are not building the trust and relationship to them, and you are not empowering yourself, and you are not empowering them as well. Okay, in communication it has to be clear, it needs to have clarity. You need to be clear, you need to be heard. Okay, if a tree fell on a mountain in a forest and no one heard it, there's no sound. Again, if a tree fell and no one heard it, there's no sound. Meaning to say, if they don't know it, then no one's going to know it. So you have to be heard. And of course, in communication, you have to give respect to be respected. And with that, you're going to build a good attitude for you and your organization. How to build that? You have to have positive mindset. They will be engaged and they will be committed. The next one is performance. And in performance, if you build those trust, relationship, communication, attitude, you're going to build a good performance to your people. And by building that, you're going to do excellence, okay? They will do accountability, authority, responsibility, confidence, and competence, okay? See, you include the three domains of a person to be for your people to be empowered. And it is going to be a good culture for you in your organization and the people around you, because you will release, if you have all of this, you'll build a positive energy, you'll become an inspiration, you will feel a life of fulfillment, and they will feel the life of fulfillment, they will be engaged, and they will feel a clear connection to all of you. And if a culture is built, it will have clarity, they will bring capability to the people, it will need focus to lead to your vision, and will lead to a great results of your organization and you as well, okay? And I think, and that's how to enable and empower other people. And I hope you learn right now. And we are dealing with the COVID-19 right now, but it's up to us. It depends upon our choice, okay? Be happy or be sad. Just think positively, okay? It's either to see opportunities or not, okay? And then just adapt and empower. Empower yourself, empower others, coexist with the virus, okay? And live with it. What do you have to do? Be the best person that you can be. And there are lots of babies waiting for us out there, for the parents, for the mothers, for the brothers, sisters, and for the nurses. Lots of babies are waiting for us out there. And let's care for them. Let's care for the carers and care for the people. Thank you very much. Mabuhay. God bless and stay safe.
Thank you, Dr. Jan, for that very informative and remarkable topic. I am sure that our participants learned a lot in which they could apply in their daily work in the new normal. As we now finish with the lecture, we will proceed with the question and answer portion. May I call on Ms. Sandela Zamora de Guzman for questions?
Okay. Uh, Hi, sir. Hi, sir. Okay, we have some question, but I think all the question has been answered already. And any further question? One of the question that has been answered already is a virus can be passed to other fetus, sir?
So actually, I mentioned that already. It's about to be ruled out that there is no clear data that it can be passed to the fetus, but it's not present on the cord blood, and as well as other maternal discharges.
Okay, Mary, is there any other question?
No more, ma'am. So I think we may now proceed to our presentation of Certificate of Appreciation. For that one, allow me to call Dr. Minerva de Ala to read the citation.
Okay, thank you. This certificate of appreciation is awarded to Dr. John Oliver de Leon for his invaluable contribution in the advancement of maternal nursing by sharing his expertise as resource speaker during this webinar entitled Maternal Nursing Care During Pandemic, Nurse Enabling and Empowering, given this 3rd day of October, year 2020, signed Mr. Sam Marceliana, the chairperson of this webinar, and yours truly, Dr. Minerva de Ala, the Dean of the School of Nursing. Thank you, Dr. Jan.
You're welcome, ma'am. Thank you rin po for having me. Thank you, PWU.
Thank you, ma'am. And now let me call on Mr. Sam Marceliana to present our token of gratitude for our dear resource speaker and to give some reminders about the webinar link evaluation.
Thank you, Ma'am Neri. For our token of appreciation, this charcoal and graphite portrait is made by an artist from Binyan City, Laguna, and be given to our resource speaker, Dr. John Oliver Z. De Leon, as a webinar committee's token of appreciation for his invaluable contribution in gracing our today's webinar event. For our webinar evaluation month reminders, please provide an existing email address and double-check the spelling to receive the e-certificate. Only those who completed and accomplished the evaluation form will receive the e-certificate through email provided during the registration process. E-certificates will be distributed after the webinar session. And if it happened to be there were no confirmation of registration letter sent back to you, just answer the evaluation form, and if it proceeds, we are still getting your e-certificates. As we near the closing of this webinar, it is also important for us to know the different aspects on how we still improve the quality of different webinar sessions. With that, we're asking all the viewers and participants of this webinar to evaluate us using the link. It is being flashed in your screen right now. It is https://tinyurl.com/PhD maternal eval. Again, it is https://tinyurl.com/PhD maternal eval. On the other hand, if you have your smartphone and if it has quick response code or QR code scanner, you may also scan the QR code being flashed. It is important for you to evaluate since this will serve as the basis of our webinar e-certificate. Again, thank you for your cooperation and for participating to this webinar session of us. Keep safe, everyone, and good day.
Thank you, Sir Sam. To give us the closing remarks for this event, may I call on the professor for the course Practicum in Nursing and the Dean of School of Nursing, Dr. Minerva A. De Ala.
Okay. Thank you, ma'am. Okay. To Mr. Marcos Benitez, the University President, Dr. Felina C. Young, the Chancellor, Dr. Minchita Dumlao, the Research Director, the LMS Administrator of BWU, Dr. Jan Oliver De Leon, our resource speaker, faculty members, students, guests, good morning. The prevention and treatment services for non-communicable diseases have been severely disrupted by COVID-19 pandemic. There was a survey conducted by WHO to 155 countries during a 3-week period in May 2020, which confirmed that the impact is global and the low-income countries like Philippines are mostly affected. According to the Director General of WHO, many people who need treatment for diseases like cancer, cardiovascular diseases, diabetes, have not been receiving the health services and medicines they need since this pandemic began. These also include the disruption of services of antenatal, delivery, or childbirth, and the postnatal care. It was mentioned by our speaker that COVID-19 resulted less accessible maternal services, unplanned pregnancy, and heightened vulnerability to violence against women. Thank you, Dr. De Leon, for sharing the important information about the interim guidelines of DOH on the continuous provision of maternal health services during COVID-19 pandemic. Our students here are better equipped with knowledge on how our healthcare system addresses the challenges of delivering maternal services. We are very grateful for your insights and information you have shared to us. Also, I would like to commend the hard work of the organizing committee, headed by Mr. Sam Marceliana, for hosting this activity, and to our ICT and multimedia team for the help and support you extended to make this activity a very memorable and successful one. Thank you and good morning.
Thank you, ma'am. This webinar will not be possible without the help of the following: Mr. Marco Alfredo Benitez, the University President, Dr. Minerva De Ala, Dean School of Nursing, Professor Practicum in Nursing, Dr. Menchita F. Dumlao, the Program Chair, Information Technology, Mr. Michael Ventanilla, Information Communication Technology Department Head, Mr. Bob Tomas, the Multimedia Broadcasting Team, and Ms. Lourdes Cabatuando and Mr. Emmanuel Kiban, Web Administration. Ms. Celia C. Francisco, the Administrative Assistant from the School of Nursing, Mr. Nelson Bigilian Jr. from the Admission and Marketing Manager. And for the webinar committee, Mr. Sam Marceliana, our overall chairperson, Program and Evaluation, Ms. Erlita B. Villamiel, our secretariat, Ms. Andela Zamora de Guzman, our co-chairperson, and yours truly, Neri Kahayan Avicilia. And to close this webinar, let us all sing the Philippine Women's University hymn. Okay, before we end this webinar, may I call on Dr. Janice De Leon for his final talk.
Thank you so much, Ms. Mary, and thank you so much, Sir Sam, Ms. Sandy, Mr. Lita, and together with everyone from the School of Nursing, to Dean Minerva de Ala, and to everyone from the PWU. It was actually nice to be back at PWU after I think almost half a decade, and I'm happy to be back. Thank you. I'm a proud Philbominian, and I would like to thank all of you for listening, and I hope you change your lives. And thank you so much, everyone. And for those who wanted to do the review, you can see me at Carl Barita Review Center. Follow me on Facebook, Janice De Leon, public figure. And for more learning tips, please visit my TikTok account, Dr. Janice De Leon, Dr. Janice De Leon, for learnings and wellness. Stay safe, everyone. God bless you all. And thank you so much, everyone.
Thank you, Dr. Jan. Thank you, everyone. Thank you, everyone, for your participation. Have a nice day, and let us all keep safe. Bye.
Thank you. God
Thank
bless.
you.
Bye, everyone.